community, you want to think about the word LOVE. When you think of those who service all our queens, sheroes, sisters with superpowers, it takes a sister power or a couple of sisters with superpowers to know what that is. So I want to say thank you for them joining us here and rolling out Health IQ. But I also want to say to everyone else out there that superpowers and sisters with superpowers in particular and Health IQ is hoping to create a safe space for healthy dialogue that increases our IQ as it relates to our health. But for sisters who do that, there's this beautiful place called Sister Love. And in this place, it's a safe space for those who are dealing with HIV, for those who need to figure out COVID, but for those who just need love as it relates to health. I want to welcome both Dazon and Africa to Health IQ and say I love you and I love what you do. And thank you so much for all that you create for our community that it definitely wouldn't have created without you doing your part. How are you both?
Awesome. And thank you for having me and having us.
Yes. Well, Munson, if you know me, I'd say I'm going to be happy despite the And
Mhm.
and I'm also grateful and thank you for helping and representing and being with us as we tell our stories. So thank you for giving us the space to do that, Munson, for
No, I
years.
love it. And I love it. It has been, but I think it's a purpose driven life for you and what you've done. Obviously, health IQ is critical, health in general. So let's start with you, Dazon. Why
Mhm.
don't you give us all the elevator pitch on the beauty and why and how for Sister Love? And then we'll kind of dig into the whole HIV reality, COVID, blah, 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 but clearly a community service. Just share the vision as the visionary on Sister Love.
Sure. Well, thanks again. And thanks to everybody for joining us on Health IQ. It's our pleasure to be here and to continue telling our story. So I am the founder and president, and I also call myself the chief operating culprit at Sister Love. And we are 32 plus. Well, we'll be 32. So we're 32-year-old, what I call a sexual and reproductive health, rights, and justice organization with a very thick lens on HIV, AIDS, and other sexual health challenges. And we do this with what we consider women and girls of African descent and their communities, which by my standard means everybody. Because what I know for a fact is that when Black women organize, when we get it together, especially once we get it together for ourselves, but it doesn't even matter if we got it for ourselves, when we get it together, we get it together for everybody. And that's part of, I think, a vision that we have at Sister Love is that as we go in on health education, the intersections of service delivery, the advocacy, policy work, the research, the leadership development, and bridging it not only locally, but nationally and internationally, then that's what we're doing. We're helping solve problems for ourselves and by doing so for everybody else. That's what we do. And we just want to make sure that people are able to live healthy and well and to achieve what they want to achieve in their lives, especially if they're women, because they can.
Okay, so I'm gonna let you have that and let you make it on that for that moment. But it's so much of a beautiful story. Congratulations, 32 years of doing anything to serve our community takes more than a constitution. It truly can takes a angel, it takes a queen, someone who understands how to build a fiefdom and a safe space for our community. So thank you so much for being dedicated, because it is not easy. And truly, when you start talking about the topic of health, everybody's not even dedicated to health. So you're trying to encourage somebody to do something for themselves that they won't do for themselves. So it is a tough conversation in our community about that. The other thing is you've got to have faith as it relates to healing. And when you think about how healing conversations take place, Africa, where are you and how are you healing and sharing the healing language and information at Sister Love?
Well, again, thank you, Munson, so much for having me here on Health IQ. And thank you for what you're doing with this podcast. One of the big things that I like about where we are in history is the length that we have now through technology to share so much more information. And so thank you for doing your part to do that, because information, as we know, and knowledge is power. So I have had the awesome opportunity to work with Sister Love, now going on, I think about 4 years now. I think I'm about 4 years in. We've worked so much, I almost can't keep up. Over that time, I've had several experiences that landed me here in this position as the faith-based coordinator. It was a part of who I was. However, working in this space and with this wonderful queen has allowed me to explore that and to expand that and to um, help in our community. And so by doing that, she just gave me Dazon, and the agency gave me the opportunity to do something that was already in me, which is to help people through their spirituality. So that allowed me to also incorporate the healing piece of providing resources, providing information, and then connecting our faith-based community and organizations and leaders with our community-based organizations and leaders, which has allowed us to expand our arm and all that we do and to reach more people, to provide the services, the resources, the education, and the support. Because as we all know, especially with what we've gone through in this time in history, it's been vital to many of our communities to have the support that they need that at one point they may not have gotten. And so by connecting our community-based organizations with our faith-based organizations, it's allowed us to become stronger, unified, and be able to provide more support and more healing, with all of the resources, all of the information, and then all of the love and the passion that I found exist between leaders in both our community-based and faith-based organizations. So it's been an awesome journey for me thus far, and one that I hope to have the opportunity to continue for quite some time.
Well,
So
I'm glad that that's your experience, because I didn't have that experience with HIV. I mean, I was over at Mercy Mobile, and you're saying it with passion and conviction that I never found.
mhm,
It was burnout because I was doing outreach to homeless men. I was passing out bleach kits in alleys, and you're saying it politely. And I know that here, but we're gonna keep it real long. It is a tough job for
yeah,
what you have. The conversations regarding health are so painful for those people who are delivering services, to try to get people to understand you cannot hate somebody with HIV. You cannot just pray HIV out of somebody. You have to talk about sexual behavior. We know that you're not used to mixing your Jesus with transgender, but you've got to open your eyes and have new lens. I mean, I believe that healthcare right now means that you are literally an ophthalmologist of life when it comes to how you approach this conversation. I didn't find it easy and have not found it to be easy, because our community does not, we're much more happy to talk about anything but what sex really means and what the experience of sex and the consequences of the lack of truth being inside our community. So I applaud you, but I want to let the community know that we are saying there are conversations that must come out on Twitter, and you must be honest about who and what you like. Like
mhm,
at the end of the day, there is more pain and danger in the closet than out. There's
this is
more
true.
pain and danger in you not being able to have the adult, mature conversation about, hey, let's quickly do these rapid tests. And before we have sex, let's do these rapid tests. And literally, it don't matter how old you are.
Right.
I don't want to assume that you're heterosexual. I really want the
Absolutely.
test to prove it.
Well,
That
here's
you
what
are
I found. And not to interrupt you, but here's what I found. What made it easier? Not necessarily that it's easy, because any work, the word work actually means that it's going to be some work, and it's not going to always be easy. But what has made it easier is that now a lot more of our faith-based organizations and leaders are more open to being educated about information that they once did not have the opportunity to get. And so that being the case, what I've done as I'm working with them in the field, I'm saying to them, listen, I'm not trying to change your belief. What I am asking you to do is to open up your space to learning the other side and learning something new. And then getting information that you can then pass on to your parishioners, to your congregants, to your community members, and allow them to make the best decision for themselves. Because at the end of the day, including with religion, it's all, or spirituality, it's all about each individual person making their own decision. And so if we are providing information and resources, we can empower people to make the best decision for themselves. And as well, then now we're learning not to judge, because at the end of the day, we all have to do what's best for ourselves. And so we just want to empower and support people in doing that by providing them with information.
Yeah. And the other part that we do, which I want to make sure we're also keeping it real, is that we recognize, I talk about how, especially when we're talking about Black women and then Black people, is that we are always relegated to the bottom of just about every barrel when it comes to healthcare and health outcomes. And so a lot of times and not a lot of times, but after all of this time, because, June 5th this year in 2021 marks 40 years since we first learned about HIV, and not even HIV, but just this weird cancer that was happening in people in Los Angeles and San Francisco and New York, mostly white men. But let's not be confused. I know Black men and Black women who have been living with HIV and or AIDS since 1981, if not sooner or before that. So this has not ever been somebody else's challenge. It has always been ours. And so if we draw back the lens a little bit, which is what we do at Sister Love, is we recognize, especially just what you, Munson, and Africa have been talking about, is almost looking at it from the individual and from the behavior. What we also know is that systemic racism, systemic sexism, systemic homophobia, systemic poverty, systemic houselessness, systemic unequal or inequitable access to education, healthcare, good paying, or at least livable wage paying jobs are all a part and parcel of what makes HIV and now COVID-19 more disparate and much more deadly for Black people and for brown people than anybody else, because you can track wherever people's human rights are being violated. That's also where they're most vulnerable to epidemics, pandemics, climate change, all of those things that are happening, because the system is not set up to make sure that we thrive. The system is not set up to make sure that no matter how many individual best choices you make, let's talk about Black maternal mortality right here, right? No matter how many individual choices you make, if you have a race-based system that delivers healthcare differently, that provides or denies health education in certain communities in certain ways, then your behavior that isn't safe is only going to compound that. So sometimes we're not trying to create safe spaces, honestly. We're trying to create courageous spaces. We're trying to create spaces where we know it's not set up for us to be all that we can be. And so we have to be courageous to step outside of our comfort zones and recognize each other's humanity, recognize each other's desires, recognize each other's aspirations, recognize each other's pleasure, and also celebrate each other's differences. If we don't find out how to do that with and for ourselves, how do we expect anybody else that already treats us differently because we are looking different, sounding different, walking different, thinking different? So I think that the work that we do around health, and where the IQ for me in health comes, is in understanding that health is a human right, that it is your human right, and that it is inextricably intertwined, interconnected, intersectional, and interdependent with everything else you have to tackle in your life in order to be whole and to feel like the best human being, the best father, the best mother, the best parent, the best child, the best student, whatever it is you are working towards your best. If you don't recognize that all of that stuff is going on at the same time, then you're playing whack-a-mole and you can't catch up to the best of yourself. And so that's the kernel where we work and live, is in understanding all the intersections that are you. All must have responses that deal with all of those intersections, not just one or two pieces of who you are. I don't know if that made sense.
No, that's what your brother calls a long pause. You know, it's sometimes that you want to let it sink in. You want to talk about, I think everyone who's talking about health and treatment is talking about the whole person. You literally, and what I share with people is, and they're having this discussion about COVID, and I'm like, the ecosystem for us to exist in this country is mired in a distinct racial profiling way before. So you talk about getting to the back of the bus. We were at the back of the bus when it came time to get a shot. Call somebody, get on and make an appointment. We know that all of that type of service delivery versus access to care put us at the back of the line.
That's right.
Made us wonder, well, how did those people get their shots before me? Or how did that happen that they were able to get their delivery? And you never thought about coming to my neighborhood. Oh, now you want to come to my neighborhood 6 months after the fact and think about inviting me, and the fact that you never invited us from the beginning. And oh yeah, we're going to spend $2 billion actually communicating, but none of us know where that money is. We don't know who at the state level has that ability to communicate that to Sister Love rolling out. And we weren't invited to the party before the cake came out. So then they sliced up the pieces, and by the time it gets to us, it's crumbs. So
dried up crumbs.
So I just wanted to say, I understand the whole ecosystem as it relates to treating the entire whole community of love. Love everything that you said. So we got to take that as sound bites. I just want us to also open our community up to understanding that love is part of how. That's why I always enjoy the name Sister Love. It is not Sister Healthcare, it's Sister Love, because we must equate health and love together in every inch and effort of our being. Maybe you can describe where the intersection of love and health should and could be if we created this whole ecosystem of love and loving ourselves health-wise in our minds for both women and men in our community.
Absolutely. I'm going to start because I know that Africa has a, you know, as a most recently ordained minister, has a whole beautiful embracing of this thing called love. But and where I come in on this particular question, first of all, Sister Love isn't just our name, it's who we are. It's how we are even when we're not perfect, we're perfectly intentional, right? And our tagline might tie it together for you in and of itself. Our tagline is healthy loving is healthy living. So if you reverse that sort of question, and if you ask yourself, is my love healthy? And you started with, is the love I have with my partner healthy? Which means, do we have a mutual respect? Is there a sense of equal effort to embracing and being together in a way that continues to affirm my humanity, spiritually, emotionally, mentally, physically, universally, right? That's that alignment that has to happen in order for that. It doesn't have to always be bi-directional, because love is just something you have to give. I even talk about how gratitude for me is the other one. I live by grace, gratitude, and forgiveness. Gratitude is love feeling loved. That's what it is. And so if you can be thankful that somebody thought enough to feed you, to clothe you, to teach you, to care about you, to make sure that the world was safer for you. And when it wasn't safer for you, that they were there to protect you. And when they couldn't be there to protect you, that they at least prepared you and gave you what they could so that you could protect yourself. That's love. If you can feel that for yourself, then you can feel it for someone else. The other part that I think intersects this issue around health and love is, you know how they say, especially for us young Black folk, that we get older, but we don't look our age. My mother just turned 80. She looks like she just turned 49. And they always look at folks and they go, ooh, Black don't crack. And I go, only on the inside, right? And so it's true. We look good, but we feel like crap. And that's because there's so much unloving that we've been going through, and we don't even recognize how that plays out. Folks don't recognize, for example, that preterm delivery is disproportionately epidemic in women, in Black women, the same way that maternal mortality is epidemic. Georgia, between the state of Georgia and the state of New York, nobody else in this country has the higher Black mortality, maternal mortality rates than we do. And do you know what they have basically whittled and distilled it down to? The core element, the critical reason for Black maternal mortality, it tends to be around the stress of racism, the stress of racial discrimination, of racial systems that don't provide the right health care, the racial systems that say you Black people have thicker skin, so you don't have the same kind of pain, or you Black women are strong and resilient, so you don't need these same kind of medications or treatments or therapies or education. That's showing me that you don't love my humanity. And so if I don't fight for that love, then I'm not fighting for my healthcare either. And so that's how we have to put it together, is that it all starts with your dignity, your humanity, and your sense of your ability to feel protected, to be protected, and to protect yourself and the ones that you love. And when I say the ones that you love, I'm not talking about the ones that you are attracted to. That's another thing. That's a different kind of love. You know, there's like 7 of these kinds of loves. Can you have all 7? And can you have them all in alignment? And when you have all 7, and they're pure, and when I say pure, that means they're real, that you know it when you see it, when you feel it, when you smell it. When you can have all 7 of those, then you also have the best of healthcare you could possibly find.
Well,
I definitely want to follow up with something that Dazon said.
I
And it
thought
was
you
a
were going
word that
to
she
start off
used.
with a song or a prayer.
Neither one, although I can do both. One of the words that she used at one point was the word whole. And so that word for me made me think about 2 verses that are very simple. I'm going to paraphrase them. Do everything in love, and love covers everything. So when you actually, first love yourself, it gives you the opportunity to be whole and then be able to look at everything else from a different perspective. Loving yourself enough to advocate for yourself when it comes to your health, and then be able to teach others to do the same. When you go to the doctor, yes, that's the doctor, but you brought yourself to the doctor. You love yourself. And so when you're sitting in front of that doctor, you're going to advocate for yourself because you love you and you brought you to that doctor, and you're going to teach that doctor how to love you as well. Asking questions, being honest and straightforward. And if you don't have a connection with that physician, then find another one, because you love you and you brought you to that doctor. When we talk about love, teaching others. As an ordained minister, one of the opportunities that I have on a regular basis is teaching people. And it may not always be biblical, although for me, that's my foundation, but I'm going to meet you right where you are. So even when it comes to healthcare, another verse that comes to mind, study to show thyself approved. Do your own research about the medications, about your health concerns, about the things that affect you. Know your family history, your family health history. And let's be honest, historically, even in the Bible days, which is a part of our history, we were not thought of as people, human beings with rights. So, unfortunately, sometimes we don't know how to love ourselves, which is why we end up doing things like self medicating or not even going to the doctor. And then when we're there, we're not speaking up for ourselves. So, this is for me the opportunity to teach someone that it is okay for you to have a different perspective about your health than the doctor does. It's okay for you to say, you know what, doc, I don't think I want to do that. So let's have another conversation or let me talk to another doctor. It's okay for you to research about the medications before you take them. And if you're not comfortable with taking it, say, listen, we need to try something else. Loving yourself is puts you in a place of being whole, and then you can actually help others learn how to do that, and then you can actually teach others how to love you. So again, doing everything in love and love covering everything, and it starts with you loving yourself and then teaching others how to love you,
Mm.
even down to your health.
I
You
love
got
that,
that
but
awkward silence again, Munson.
no, not quite awkward. It's just a long pause that gives everybody like a woosah, uh,
Mhm.
or a reverence that what you said, you meant it. It was free. Let people receive it. What I found is sometimes people aren't ready to wear the information
Yeah.
and they don't want to hear the information. And then you have hosted moderators, and that person can't hear that love was part of this conversation and that what you said was meaningful. And the whole proposition of being an advocate for yourself, maybe they didn't hear that. So I wanted it to sink in. Maybe they didn't understand the methodology. I wanted it to sink in. Maybe you didn't understand that this is a love practice, because what I hear is a practice, a healthy love practice of what it is. I think we've got to clearly say that when everybody decides to get naked. You know, if you're sitting there, what is a healthy love practice? And we've got to make sure that we are saying that out loud, because there are healthy love practices.
Yes.
And what does that mean, a healthy love practice? And the
Mhm.
fact that nobody, whether they 25 or 85, they still in some type of love practice. Now nobody wants to hear it, but it's
Right.
on the minds of many people, you know. And so when we say that, it's just a love practice that, you know, open and honest, and where you
Mhm.
are and where you have. If you love me, then I should have this place, a safe space, that you have a love practice that is open, that is honest, that reveals your lovers, that reveals things that you don't like. So we
Right.
don't have to bring that in the space because I don't like that. Or have you had this experience and you feel comfortable enough to say, yes, and I like that too? So I just wanted them to hear your voice, because I love the way you brought advocacy and
Mhm.
advocate. But I also want, when we think about HIV and sex in particular, that, you know, because at the end of the day, when we talk about HIV and ultimately if someone ends up with AIDS, it's an acquired thing. And I don't want to, in the 40 years that it's been around. So in my entire lifetime, it feels like it's been around. And even
Mhm.
though most people don't want to think about it, it was the most awesome, feared thing at one moment.
Right.
And now there's a level of normalizing
Mhm.
what something you don't have to choose. And I think that at the end of the day, as we're having to share, well, if this is a behavior, then you're going to have to think about, how do you think about and break in the conversation of PrEP? If you're going
Right.
to think about it, how do you think about the whole idea that I'm sexually fluid and I'm a young person? And
Right.
so when you think about all these conversations and doing it in love, it is a conversation that literally requires constant optic evolution.
Absolutely.
Absolutely.
Absolutely. And innovation in all ways. Right. And so I'm glad you landed on that, because one of the things that we're working on right now is, why aren't more of our people taking up PrEP? Why aren't we learning all of the new news about the science? Because it's not only that we have gotten, sort of complacent or accustomed to the fact that HIV is around us because it's been 40 years, but it's also because there are people who love what they do, and they love what they do because what they do could actually change things and even save lives. And some of these people are people I love because they are scientists. They are, I grew up in a house of scientists, so I have a very healthy love and respect for scientific people. But the fact that we have folks who have figured out how, for people living with HIV, you take these medications and you take them in one pill, even. We've gone from 60 something pills a day down to one pill a day for a person living with HIV. That if you take this every day, you get your virus under control, you become what we call undetected. How about, they didn't say you might not, you could not, you cannot transmit the virus if you are undetectable and you sustain that low viral suppression. That is big, especially for people who have walked with HIV, thinking of themselves as vectors, thinking of themselves in shame and guilt, hating who they are, or being mad at themselves or shamed about what they have done, not necessarily what has happened in their lives. And now you don't actually have to walk with that because you are not the threat that everyone has put you in the box to be. And for those people who are not living with HIV and have been putting the whole burden on people living with HIV to tell me your status, to make sure you're practicing safer sex, to using condoms, make sure you're telling everybody, what's going on with you so that we know. First of all, that was never fair, because individuals always have had the opportunity to prevent HIV from happening to themselves by using protection, by saying no when the gut tells you that that's not the right time to engage in something that's got elevated risk to it, right? There are people who are not living with HIV who can also practice methods of prevention, whether it is using condoms, internal or external, because those things exist. But there's so many things in addition to taking a pill a day that a person living not with HIV could also, for the rest of their lives, never get HIV if they do what they need to do. That also is an act of love, is saying, I am going to protect myself first and then protect you. That's how this has to go. And a person living with HIV had never gotten permission to protect themselves first. They were always told they had to protect everybody else. That message has changed. The message around whether I'm at risk has changed. I can't tell you how many women I know living with HIV, all they had was one partner. They had one man that they loved in their lives. It wasn't them doing things to get HIV. It was them being in love with somebody and trusting that somebody. And that other somebody, just like you were saying, Munson, it didn't mean that they didn't love anybody. It means that there are enough people who were so judgmental about who they are and what they were doing that they're in the closet. And that African proverb that says, he who does not speak his ills cannot hope to be healed, right? And so if we create spaces where the only way you can cope is to keep all those secrets, secrets will kill you. Secrets will eat up every T cell, every antibody, every inch of your immune system so that you can't fight some of these things. So we have abandoned this notion of risk. We don't want to talk about risky behaviors. We don't talk about whether you think you're at risk for this or that. What we want to talk about is, what is your desire? What is your plan? What is your hope for your sexual health, for your sexual well-being, and for your sexual pleasure? What do those things mean to you? How do you value them? And then let's talk about the tools that are out here to help you achieve those things that mean the most to you around your health, your well-being, and your pleasure. Because the other part is, how do we expect to talk to people? That's what I learned when I first got in this work. I created the Healthy Love Party because the failure of trying to go out in the early 80s and talk to women about Now you got to talk about sex. You have to be assertive about the kind of sex you want. And you have to be able to ask your man all of these questions, or ask your partner, regardless of their gender identity or whoever else they might be in relationships with, that you have to ask your partners all of these questions. You have to know all of this about their business. Oh, and now you got to all of a sudden do what nobody else has told women that you can do, is speak up in the bedroom and assert yourself with what you want and how you want it and all that kind of stuff. And then put in this question of whether or not your partner might have some disease that you might get, and you got to introduce something new. Nobody is thinking about their sex or sexuality from a position of risk. Nobody is. It's about how I want to be loved, how I want to be in relationship, how I want to feel pleasure. So let's talk about what we have that's going to help you get that in place. Don't worry about your risk. Let's talk about whether what we have is going to help you achieve that. I might like multiple partners. And now you're telling me because of a disease, I can't have any. That is not the truth. The truth is because of a virus and you like multiple partners, there are some things that you can do to keep liking multiple partners and still stay healthy, still stay safe, and keep others safe at the same time. Let's talk about it that way. Let's not talk about the things that you're doing wrong. I always said, I want to create a workshop. I want to create a space where people can say yes, not say no. It's not about what you have to say no to. It's about what you can say yes to. That in and of itself, I think, is creating a space of love, because now who and all of who you are is accepted. It's acceptable. It's acceptable to you, and it's acceptable to everybody else here, because everybody else here also wants to be accepted and acceptable.
Usa, yeah.
Sila.
So the whole idea of shame, stigma, not wanting love to be the primary conversation inside our community. COVID has not changed the role. STDs are still available during COVID. HIV still available during COVID. The violence still available during COVID. The shaming of not being vaccinated still happening during COVID.
How about that?
The idea that the community doesn't need more than just COVID shots. We got billions that just came out of the woodwork for COVID. Haven't had billions for maternal health. Clearly hadn't made a ton of rap songs with maternal health on there. For you, during this period, what can we do during COVID to really position ourselves to come out of here with a reset? Because the one thing I'd love for us to be able to do, you see that love, is to be able to reset our health practice, because we need a health practice right now as it relates to, because you're a provider and a healer in the community. Absolutely. What can we do to reset ourselves so that we see COVID as a new love practice and how we practice loving ourselves healthily?
The first thing I'm going to say is that health literacy, people have to be able, the same way, folks understand the fundamentals of literacy. And I mean the literal literacy, the fundamentals of knowing how to read, and where you may be less able to make things happen in your life if you are not able to read. And there are people who are not able to read and get by, but they're not able to make the best of what is if they're not able to read. It's the same thing. If you are not able to understand what health is and how it plays, you don't have to go to medical school. You don't have to know, all of these different things that your body does. What you need to know is what your body does. You need to know what things are important for your body, the right things to eat, movement is important. Paying attention to what goes in your mind and what you bring out of your mind. That's a part of health, and that's a part of love. The health literacy levels in our community are so low that our understanding of health is, can I move and can I get to work today? And can I make it through a work day, even with pain, even, with everything that doesn't feel right, that I didn't feel 20 years ago? If I can just get through work, if I can just get to the end of that block and back, if I can just get my kids out the door to school, that's their level of health. And when that goes awry, now I need to do something. Preventive health is where the reset is. The reset is in thinking about what kinds of practices, and you have to practice, that's how you get perfect, right? That what kinds of practices I need to put in place, not whatever everybody else is doing and telling me to do, what I need to put in place that's going to make sure that all of my health is in the best place possible before things happen. If I'm taking my vitamin D, that's something that a lot of people didn't understand. If I'm taking more of my vitamin D, if I'm doing my C's, right, then I actually am building up a different immunity to if I'm exposed to COVID. Not everybody is telling you that. Not everybody is telling and helping us understand that as Black people, we have some of the lowest levels of vitamin D intake, which puts us at the much higher risk for cancers, and to die faster from cancers, from the hypertensions, from the cholesterols, the things that happen. People walk with these kinds of diseases every day. They don't die from them because they have other things going on, whether it's nutrition or health or otherwise. And while we're worried about COVID, heart disease is still killing all of us more than anything. And isn't that where we're supposed to have our love living in the first place? So if that heart disease is physical, then where is your emotional part? Where's your mental part? Because all of that is a part of what makes love happen and what makes stress happen on both ends of this whole spectrum of love and health. So health literacy is a key point for me, and becoming informed about what that means. Africa talks about asking questions and teaching your practitioners, your physicians or clinicians to love you, to respect you, and be able to inform you. Go in there with some information. If anybody is taking a prescription right now and you don't know what that prescription is, you don't know what pharmaceutical made it, you don't know what it's supposed to do, you don't know why you have to take it at the same time every day, the way they tell you, that means your health literacy is at this level in order for you to achieve the health outcome you're supposed to with that prescription. You might want to elevate that literacy a little bit, and it's going to solve some of the other problems. In addition to that health literacy piece, the other part of our reset is we actually do need to look out for each other. That's the other part. If communities paid more attention to that pregnant woman and not just the people in her household, then folks will want to know what's going on with her when she gets closer to labor and delivery. People are going to want to make sure that she's not catcalled. They're going to want to make sure that she's not being violated or violently abused by a partner, because that happens. If there's already violence and you're pregnant, violence goes up with the pregnancies. If there's somebody who is addicted to substances and just can't seem to get off, we don't throw those people away. Right? You keep trying to make sure that they know at least what harm reduction looks like, even if they're not going to be able to get to the total recovery or to complete to get off those drugs, medications, or alcohol, or whatever their substances are. If you have any semblance of what it used to mean for us to take care of each other, then you have to get that back up and running. Because that's what COVID has taught us, is that when you didn't hear from somebody, I have gotten in that space. Tell me if this has happened. You haven't talked to or heard from somebody in a few days or in a couple of weeks, and you heard from them on a regular basis, or you saw them on the street at least every other day doing what, old so-and-so does, but now you haven't seen them. You can't get them on the phone. I'm telling you, the first thing I start thinking is, Do I need to start calling hospitals? I need to see what ICU they're in because that sounds like a COVID situation. We didn't do that before, but now we need to do that about them all the time, not just in the middle of a pandemic. So that's what I'm thinking. Health literacy, one, and then we really do have to reset how we look out for each other. I bet you we got to know neighbors that we didn't know before we were all stuck at home. We got to know our delivery people that we didn't know. How long has it been since you didn't know the mailman's name, but you know him now, right? So those are the kinds of things I think that this moment is allowing us to reset. And in the midst of all of this other stuff, you know, the Black Lives Matter and the immigrant lives matter and young people's lives matter. The more that we look at all of these places where Black communities have just been ripped to shreds over 401 years, 2 years, over 402 years, are telling us that this reset is not just about a pandemic. This reset is about our people. And if you start there, then there is nowhere we cannot go to restore ourselves. I mean, it's in the middle of a pandemic. You got white people talking about reparations. Can I get an amen on that one, Sister
Amen.
Africa?
Amen.
I'm just saying, what? Wait, what? And I mean in a real way, not in that negative, not in that denial way. For those who want to deny, they already were there. But for those who are here in this new day, it's like that's what this opportunity has brought us. As much pain and loss as it has brought us, it has also brought us the opportunity to reset how we see and care about each other, how we stand up for ourselves, and how we decide to learn more. Nobody was interested in vaccines. Everybody kept talking about, I love this one. Everybody kept talking about this medical mistrust, you know, and they all want to blame it. Black people don't trust the medical system. We have a whole lot of reasons not to trust the medical system, but that's the people who were informed, right? The majority of us didn't know we weren't supposed to trust the medical system. We know how we got treated in the medical system, not what y'all were doing behind curtains and in the labs, but how you treated us when we got to the doctor's office or to the clinic or to that public hospital, right? That's the mistrust, is how we have been treated. But we also mistrust our public service. We mistrust our law enforcement. We mistrust those who have shown to not be trustworthy. There are people who never knew that there was a medical mistrust amongst us. And the media keep telling us that, you know, Black people have medical mistrust. Now you got Black people like, oh, I'm supposed to mistrust something. What am I supposed to mistrusting? Because I can't be unmistrusting if that's what my Black people are doing. That we're perfectly fine with getting involved with science. We're perfectly fine with the vaccine technology. We're perfectly fine with whatever the doctors were saying. This is what we need to treat your problem, right? So we cannot buy into the narratives that don't belong to us. And that's the other reset, is that we can set our narrative. And I'm going to stop because it's long. But Brian Stevenson, my movement muse, he's the attorney, human rights attorney, Equal Justice Initiative, Montgomery. If you haven't been to see the memorial to Black folks who've been lynched, there's almost 5,000 of our people who are memorialized at this place. He has a tenet for sustaining social justice and social change. And it's so much from love, because he starts with the fact that every one of us is more than the worst thing we've ever done. So you start right there, that you will always be more human than your bad behaviors or your mistakes. Start right there with forgiving and accepting that in yourself. But then to sustain the change, he talks about proximity, that we have to be close. We have to be close to the issue. We have to be close to the people who are suffering the most. We have to not set them aside and leave them behind, but bring them to the table where we know decisions are being made. Ayanna Pressley says, the congresswoman from Massachusetts says that the people who are closest to the pain must be the people closest to the power. Bet. So proximity. Change the narrative. You cannot let everyone else define who we are, how we are, what we are, where we are, and why we are. We do that. Black people's language has permeated and changed everything just about every year. There's lingo that I hear other people saying that came from my community. So we know that we can change our own narrative because we're changing it for everybody else. We can say for ourselves who we are, what we want to be. Then we have to be able to protect the hope. That's where our faith comes in. That's where love comes in. That's where we have to believe that we can win and we are winning. And the last one is we got to be willing to get uncomfortable, be uncomfortable, and make others uncomfortable. Because I'm of the belief that as long as you are comfortable, you ain't trying to change nothing. And we got to do nothing but change. And so that's where I sit on all of this stuff around what this reset means for us, is that this is our chance to be the Black folk that our African ancestry intended for us to be. That's the real reset. My dog agrees.
I agree. Well, I want to thank you both, Sister Love, Sisters with Superpowers, Dazon, Africa. It's been a wonderful discussion. I think that you took us to a place where we definitely can pick up later. But if you didn't hear it, you need to watch this again. I think that one of my favorite reads so far has been The Purpose of Power. And I think that if nothing else, there is a health movement asunder. It starts with loving yourself and creating a healthy love reset literacy practice, if I got it all right. So at the end of the day, we want to invite you to check out Sister Love. I want to thank you, Dazon. Thank you, Africa, for all that you've given us in this hour. I look forward to doing more with you in the future. And we hope that all of you look at each other and love each other more, but know that this is a movement and that it must continue, and that you must not say that COVID is over versus our love has started again for ourselves, for our ancestry, and for who our future generations will experience, knowing that they were loved differently because we loved forward and didn't stop the fight for loving ourselves and the love we deserve from a society that we pay taxes in. Peace, everybody. I'm Munson Steve with more Health IQ with Dazon and Sister Love in Africa from Sister Love.